Welcome. I'm Brian Samuels, Executive Director here at Chapin Hall at the University of Chicago. Thanks for joining us today for a webinar on effective communications for human services providers. This webinar will be recorded and you will find a link for all of the participants for the recording itself. As most of you know, Chapin Hall believes that policy and practice decisions should be based on evidence. Not only do we develop evidence through our research, but we also work with service providers and policymakers to use that evidence to improve systems and to improve outcomes for children, youth, and families. Our evidence-based approach also extends to dissemination. Human service providers are a critical audience for us, from state agency directors to frontline workers. It's getting that research in those folks' hands and having them use it is what makes the difference. So what's the best way to get that information in the hands of folks who can use it on the front lines? We conducted a national survey to find out. So now I'm going to hand it off to the people who do the real work around here, Matt and Marianne, who are going to tell you more about what we learned. Thanks.
Thanks, Brian. Hi, good morning, good afternoon, everybody. Thanks so much for joining this webinar on the human services research findings. We're really excited to share this with you. My name is Matt Morton. I'm a research fellow at Chapin Hall. My pronouns are he, him. We would love for you to interact and engage with us in the chat, share your questions, share your thoughts and your reflections as we go, and we'll come back to those later in the session. First, I just want to say I'm a nerd. I like long walks on the beach and evenings of designing unbiased sampling strategies. It is what I do. But I got into this work because I believe that research fundamentally can play a powerful role in influencing practice and policy for improving the lives of youth and families. But that's only possible if research is communicated effectively for practitioners, people who are implementing research and putting it into action on a day-to-day in their work. And so that's why this study is so possible, are so important, so that we better understand what makes that possible and how we can implement research into practice. And so to that end, we sought to address four general research questions with this study. First question is, how do human service providers view the value and the use of research? Second, we wanted to understand what communication channels and formats social service professionals prefer. And then third question is understanding how their use of social media might vary by professional characteristics and ages, so that we understand how to best target and support different demographics, different sectors, different positions with the right approaches and information. And then finally, we sought to understand what messengers human service professionals trust, so that we're also working through human connections and networks that people value and find helpful for communicating research findings. So this was a survey that involved expansive work through networks and through various professional memberships and listservs and organizations to get the best and most diverse outreach we possibly could. We had 921 survey respondents that participated in the survey from fall 2020 through spring 2021. And these participants came from all 50 states, so quite a diverse and well-spread sample participating in this particular survey. And they represented more than a dozen sectors. Those sectors included a range of human service professional practice areas, ranging from addiction, substance abuse, adoption, abuse, trauma, treatment, child welfare systems and practitioners, early childhood professionals, education, foster care, mental health, physical health, and out of school time. So again, a fairly expansive overview, and it also included youth homelessness service providers. So now to the findings. So first I'm going to start with sharing some findings about human service professionals' attitudes about research and how they think about research in their day-to-day work. The first thing that we asked, or one of the first questions that we asked for folks to reflect on was how valuable they did or did not find the role of research. And it warms my heart as a researcher to say that, about 2/3 of respondents found that reported that research in general was either extremely valuable or very valuable to them. And the vast majority found research valuable at some level, with only about 5% saying it produced little or no value to them. So in general, there's a culture and appreciation of research informing human service professionals' day-to-day jobs. So that's really important. We also asked how often they tend to utilize research, and going beyond just whether they value it. The vast majority of respondents, over half, reported that they use research in their day-to-day practice all the time or often. And all but 5% said that they used it at least sometimes in their practice. So again, a really important entry point for integrating research, and a high demand for using research and having it communicated effectively for their purposes. This represents a set of findings related to how respondents thought about research, and not just whether they used it or how often, but the ways that they would describe research based on their experiences. And that context is helpful for us because it helps us understand the sort of baseline for how we can improve both research's content and its delivery to be more accessible when we know how it's currently considered. So what we did is we asked respondents to rate research according to different characteristics on a scale from 0 to 5, with 0 representing generally more negative perceptions of research, and 5 representing more positive and affirming perceptions of research across different characteristics. Clearly, there's a general organizational culture in human service professionals' work, which values research and finds it consistent with their organization's approach. So that's positive. In general, they find that research is in sync with their intuition, which can be a positive for the most part, because it means it's sort of field validated, if you will, what people are seeing in research with their intuition and what they see in the field. Although sometimes we would expect research to also debunk or challenge our prior assumptions. And generally, they found research interesting, which is great. I think where we have more work to do based on these responses is in making sure that research is much more practical to carry out. It's more easily applied in day-to-day work, and easier to grab relevant points so that practitioners can apply those findings into their day-to-day practice. And this is what we're about to kind of get into at a deeper level.
Terrific. Thank you, Matt. My name is Marianne McMullen. I am the Director of Communication and Dissemination at Chapin Hall, and I was the principal investigator for this study that we were very excited to do, and to position Chapin Hall to be even more effective at getting our research into the hands of those where it can really make a difference. So let's get down to the nitty-gritty, especially for those of you who are joining who do communication about research. Who are the most trusted messengers? What do human service providers say they most trust? They trust the people they work with. So here's a few of our most trusted sources. A peer doing similar work, number 1. After that, a supervisor, trainer, or boss, field staff, and then it goes down from there. And I just want to point out there's a concept in communications called lean to rich communications. So you got the rich ones on the left side of the chart here that are highly trusted and highly valuable, and the lean ones at the right side of the chart. It does not mean the lean ones aren't important. They're really good for reinforcing messages, but when you're really going to persuade somebody, say persuade them to do a different practice because of a piece of research, it's really important to have those rich sources, those personal sources that have the power to persuade. What formats do human service providers prefer? How do they prefer to get information about their work? Listening in person to a live speaker was by far #1. So interestingly, the survey was conducted during the pandemic, but we were sure to point out that aside from the pandemic, how would you most want to take in information? So if the pandemic was not an issue. So, I mean, arguably it could be they wanted to be around live speakers even more because they were kind of isolated, but we asked them to try to take that out of consideration. And listening in person, and then video #2, webinars, which we're doing right now, charts or graphs on a desktop, and then on down in terms of how they most want to receive work information. You will see video as a recurring theme. It's really important. People really want video information conveyed through video. So what channels do they most prefer? Again, overwhelmingly face-to-face meetings. They want to be in the room with people. I think people have a just a real accurate understanding that that's how information gets conveyed the best. If they're in the same room with somebody and they're relating to them as a person, makes a big difference. Personal email rather than a group email, and then video conference calls, video calls one-on-one. The visual element is very important here in terms of effective communications, and then on down for other ways of getting preferred information. We also asked about print and video resources. And I get a kick out of this one because when we asked print resources for work information, books was #1. So people still read books. People still, you know, when you're on video calls and everybody's got books behind them, they're actually reading those books, especially for professional information. And then brochures, print newsletters, and so on. Audio and visual sources, webinars or videos, high up there. And then a lot of people still watch TED Talks, documentaries, podcasts. We'll talk a little bit more about those later, and radio shows. These are how they ranked audio and video sources. Social media use. Contrary to the demise of Facebook has been very much exaggerated because it is still the 800-pound gorilla in the social media room. There's just no question. In February 22, Facebook saw their first decline in users ever in its history, but it's got a long way to go to be #2. So here's how human service providers, this is what we asked them specifically. Which platforms of these have you used at least once in the last week? And so you have Facebook, overwhelming, and then YouTube, Instagram, LinkedIn, Pinterest, and finally Twitter. These are the most used social media channels. Now, this one, I do encourage you to go to the website, look at the study, download it, and spend some time with this particular chart, because if you're planning a communication campaign and you want to reach a specific audience, this will help you strategize your social media. I'll just point out a couple of things here. When you go over to Instagram, the third one in, the purple column there, and you go down to age, and you see that direct correlation between age and use of Instagram. That's an example of some of what this will show you. You go over and look at Twitter on the far right. So the Twitter numbers aren't overwhelming, but you look up at the directors. The directors are using Twitter, you know, they're more dominant in that, and people who are in juvenile justice are using Twitter more. But if you're reaching out to CW is child welfare, education, OSP is out of school time. So we kind of broke out the sectors there to really look at who, you know, we realized that in childcare staff use Pinterest a lot because they're looking for lesson plans and activity ideas in Pinterest. We had never thought about using Pinterest for anything. So that was an interesting thing there. So I just encourage you to use this as a tool in your communication planning. The other thing we wanted to know is, where do human service providers get their news? We did ask specifically about National Public Radio as a general news source, and 685 of the respondents said at least sometimes, with 35% listening weekly. So NPR was a big news source. The New York Times was the most frequently named newspaper source, and 112, with 112, we didn't ask specifically about the New York Times, but 112 respondents named it specifically in an open-ended question. The Washington Post was the second most mentioned with 52. Local news source. So a lot of people still read their local dailies, whether online or in print, and 100 respondents specifically named a specific daily newspaper. So that's still a good medium for reinforcing messages. Podcasts are increasingly popular. Of our respondents, 28% said they listened to podcasts. Of those, 48% were director level, 51% were in the health sector, and 50% were in homelessness and housing sectors. So those are sectors that are more robust for, if you want to get a message out, getting your people on as guests on podcasts. The age range, 40%, the folks between ages 35 and 49 listen to podcasts, 37, 50 to 64. The results did skew a little older for podcasts. And a good thing, just to mention one more thing about podcasts, the good thing about podcasts is they're sticky. People tend, when you're reading a newspaper, you don't always read to the end of the story. For some reason, when people start listening to a podcast, they listen to the end, which is also valuable if you're delivering a more complex message or something that you can dig into in a more in-depth conversation. So, okay, I'm going to turn it back over to Matt.
Thanks, Marianne. So in addition to trying to better understand the general resources that human service professionals tend to use at GrowTo, we also wanted to learn a little bit more specifically about online resources, because this is a digital age and people are still using and consuming so much information online. When we looked at, one of the things that we did was we asked respondents to look at a long list of potential online resources that they may or may not use, and to indicate which of those that they've actually utilized. And this just gives you can go to the report for taking in more of this information in detail. But some resources are particularly heavily used among human service professionals that we sampled across the country. In the top 5 here, which include SAMHSA and their online information, Annie Casey Foundation, Casey Family Programs, very popular Child Welfare Information Gateway, which includes evidence-based practices, and Chapin Hall for our research and policy work. All 5 of these were used by over a quarter of the respondents. We also asked about preferred formats and then online resources that folks tended to rely on. And so the online resources that were most commonly used, we asked about website repositories of best practices. These were really popular. People were clearly going to online repositories trying to figure out what programs and practices had evidence and information on them that they could use. And sometimes that's required by federal grants and funding, so it makes sense that many would rely on those resources. Online newsletters were still very popular. Online academic publications, interestingly, even among human service professional group, we're still looking to these academic publications and journals for insights to use in their practice. And then online news sites, blogs, listservs, or online forums are still used by roughly about half of respondents as well. So going beyond the actual resources that they use, we wanted to know what formats were most helpful for this information to be presented in. Respondents placed a strong preference on receiving research in general, across the board, in brief, easily digestible summaries and instructions. And so no matter, this graph here shows responses divided or subgrouped by the type of position that respondents indicated that they held, from high-level direction and planning positions, supervisory training, and direct services, like frontline workers, counselors, case managers. And across the board, the value of brief top-line summaries really came through. And I think that also sort of reinforces a trend that we've seen both with policy research institutes like Chapin Hall, making more efforts to be able to distill information in really clear, succinct bullets and summaries, so that the implications are true. Even with academic journals like the Children Youth Services Review, you see highlight boxes now at the top of all of the articles that are required, where authors have to say, these are the facts. So these are the big takeaways from these publications. And that's responding to a growing demand for research, but research presented in really succinct ways, with top-line summaries presented, so that they don't have to mine or search or dig for the implications of these findings. We also did see some differences between position types. So for example, when you look at complete narratives about findings that provide a more sort of humanizing and text-based discussion of the findings, high-level directors and planning officers tend to demand those more complete narratives or descriptions around research. They seem to want to dig into it a little bit more. And when you look at multimedia collections, for example, for research in training and technical assistance resources, or information that would present the data and evidence in lots of different ways, supervisory and training positions seem to value those much more than the other positions, probably because they're the ones responsible for communicating that research and training others up in the research and the implications. So it kind of makes sense.
Okay. Thank you. So when we gave APHSA was our partner in this project, and they helped us do a lot of outreach. And when we presented the results to them, they said, well, okay, tell us what makes a difference for reaching directors specifically. So we pulled out some of those findings and want to share them with you here. One of the things we found, and that which I covered earlier, is that they disproportionately use Twitter compared to other employees. Also, that they are disproportionately represented among readers of local newspapers, and disproportionately represented among podcast listeners, and are more likely to trust a non-personal source. And a non-personal source would be a website, a research center, something like that. American Public Human Services Association is APHSA. Apologies for using an acronym. Which I'm always trying to get people to not do. So if you're trying, these are just some things to keep in mind if you're trying to reach director level people, that these are good channels to use. Okay, we want to close with talking about a few practice implications of these findings. Recommendation 1, craft clear, action-oriented messages for human service providers. You can say a lot of things about your methodology and even your findings, but if you don't connect them to actions, it can kind of fall flat with the provider audience. Make sure the findings are highlighted, are understandable, and give clear and actionable takeaways for practice. Focus on personal influencers. I think this is true almost anywhere, but this survey really reinforces that people listen, especially in a workplace context. And a question came up in the chat, if the social media findings were related to work. No, they were just general, this is the social media they use. So even though people use Facebook a lot, they're not going there for work information, right? It just happens to be a channel that they use. But when it comes to work, this really reinforced that people listen to other people who do what they do. That's who has the most credibility with them, not people on the outside, but people who they do. So reaching those of us who produce research, it becomes very important for us to reach those people who are influencers within the field who direct care providers trust. Use mass media to reinforce information. Again, it is a lean form of communication. It doesn't necessarily persuade, but it reinforces, it socializes. You know, seeing all the really positive results that Matt went over about the attitude toward research is no doubt reinforced through a lot of different mediums to say, okay, we should be evidence-based. We should be using research. This wasn't always the case, but it feels like it's really permeated the field now. But using social media and mass media to reinforce messages is really important. And recommendation 4, pay attention to those preferred channels. If they're listening to people they work with and they prefer learning about things in person, in a room, in workshops, make sure that the people who they listen to have the tools. And often those are one-pagers or clear guides or even slide decks. Make sure they have tools that are accessible, that those influencers can communicate through the preferred channels of the human service providers. I mean, it comes down to really respecting the audience and their preferences. Okay, so are there any questions? We have about 2 more minutes left. Were there any other questions in the chat? There's the URL to download the study. Any questions that we haven't addressed that were in the chat? I am not seeing any additional questions.
There is one, Marianne, that just popped up asking if we're sending out this recording.
Yes, we are. We're going to send out a link to this recording, and we'll also include a lot of these, you know, learn more and links to where the study is, so that others can see these, and so that folks who did register and who couldn't make it can also see the training.